Rick, you're going to miss your plane.
Yeah. Right, listen, you won't forget that Mr. Jackson needs his histology check. And Mr. Bell needs...
His drain out and a check X-ray. I know.
Look, Jack, I feel bad about leaving you without any consultant cover. I mean, it's just too short notice. I mean, I know that you can cope.
Stop there. I know I can cope too.
Okay. Look, if you do need any help, I've spoken to a couple of consultants who've said that they're happy for you to give them a call. I've written their names down on this list.
I'll be fine.
Okay. Well, in which case, I guess that's for you.
Have a good trip, and don't worry.
Yeah, well, I feel more relaxed already.
Hi, Lola.
Hey.
What have you got for me?
He's one of the protesters from Alice's Wood. History of chronic renal failure. Got impaled on a branch while falling out the tree. Thing is, he seems quite attached to it. Doesn't want it taken out.
Gives a whole new meaning to the word tree hugger. Morning. I'm Miss Naylor. Turn that off, please. Okay. Look, I know you want to wait, but we do need to get you up to theatre to remove that stick.
Absolutely not. We need the press coverage.
That bit of wood could be stuck in your kidney, liver, major blood vessels.
It's not going to take long. The photographer's on his way, right?
Look, I know you feel strongly about what you're doing
Strongly?
up there.
Strongly? Saving that wood is our biggest campaign.
I'm afraid you've had a wasted journey. Chest X-ray and C-spine are normal.
All we need are a few photos.
Look, your brother is in my care now, and he could deteriorate at any moment, so I'm afraid not, no. No photographers, no reporters. I'm booking him into theatre.
Yeah, whatever you say.
So, wait, I think we should scan him.
Not sure I agree.
Do you want me to discuss it with a consultant?
You just have. I'm acting up while Rick's away. I'm not convinced we should delay theatre.
Sorry, do you mean no one's covering you?
Have you got a problem with that?
No. Sorry, I didn't know. Is there anything I can do to help you?
Why, do you think I need help?
No, of course not.
Well, I see no pneumothorax, no widening of the mediastinum, no reason for cardiothoracics at all, in fact.
Look closely. Fractured first rib. That's a sign of a high-energy impact. It is associated with increased intrathoracic injury.
Yes, well, being impaled on a stick is associated with needing an operation straight away.
Okay, but he is quite stable, and we need to rule out injuries to the aorta or the main blood vessel.
Well, if it makes you happy, we'll scan him. But then I need to get my patient up to theatre, OK?
So where shall we send Mr. Cronin?
Get him a bed on Keller. I'll see him up there. We need to be ready to shift him to theatre as soon as the scans come through.
Mick, look at the camera.
Excuse me?
Look at the camera.
What is going on? Get him out of here.
Get the wood.
I said no press.
Oh, yeah, so you did, sorry.
He is seriously injured.
That's it, that's just it. Don't you see? I'm trying to get justice for my brother.
Well, it seems an odd way to go about it by putting his life at further risk.
If the doctor thinks he needs surgery, then maybe...
We're all doing what we have to do. Mick understands that. Don't you, Mick?
Yeah.
You are not listening to me. This is a very nice camera. It'd be a shame for it to break. Now get out.
Direct action, eh? Like it.
Do not push your luck with me.
Miss Naylor? They have the scans.
Excuse me. I'll be back in a second.
Well, the good news is I don't think your stick has passed through the cavity wall.
Oh, well, there's still a tear in the liver. Look, contained hematoma.
Yeah, but look here.
I can't see anything.
Well, no, that's the point. We can't see the descending aorta clearly enough to rule out an injury.
Oh, so what are you saying?
He needs an aortogram.
I need to get this guy to theatre. He's got an existing renal problem, and I could do without you obsessively looking for non-existent injuries.
30% of patients with a first rib fracture have potentially fatal thoracic injuries.
So if we don't do the aortogram, what is the worst-case scenario?
Well, if he has an aortic tear, it could rupture.
If he has a tear.
When they go quickly.
Well, how do we know he won't bleed to death in X-ray from the injury we know he has got?
I need to be able to rule this out.
Cross all the T's.
Now, I've spoken with Connie and the radiologists. They agree.
Well, go ahead then, organise it.
Good. Do you want me to speak to the relatives?
Why? Don't you think I can manage it?
How are you doing?
Mr. Cronin, there's been a change of plan.
What's happened?
We need to perform another test called an aortogram.
What's that?
It won't hurt. All we do is inject a bit of contrast dye so your blood vessels will show up clearly on our x-ray. Okay?
Hang on. A minute ago, surgery was so urgent you couldn't even wait for photos. What's changed?
If you give her a chance, then maybe she'll explain.
I'm just trying to watch out for my brother.
Hey, calm down.
My colleague is concerned about the possibility of damage to the main artery in your chest.
Who's in charge here, you or your colleague?
I am.
So what do you think?
There is an argument for either course of action.
Oh, come on. Make a decision.
If you insist on proceeding with surgery now and you're aware of the risks, then we could skip the investigation.
What do you think, Mick?
What, Mick? Well, it would be nice to get rid of it, you know?
There's your answer.
Okay. We'll get you around to theatre.
Okay.
Just with his chronic renal
Need to
failure.
monitor them. I too went to medical school.
Suction, please.
What's going on?
There's been a change of plan.
But the aortic lamp.
I explained the situation to Mr. Cronin. I told him he had a potentially fatal liver laceration. He was unwilling to defer surgery any longer.
Did you tell him about the aortic injury?
Possible aortic injury.
Yes, possible.
That we can't see on the CT scan.
I'm sorry, forgive me. I wasn't aware that acting up as consultant gave you the right to ignore everyone else's professional opinion.
I happen to agree with my patient, if that's what you mean.
I can't believe you did this. What if he has got a tear? What if it leaks?
Well, if you're so concerned, then you'll want to keep an eye on him, won't you? Get scrubbed. I could do with an assistant. Swab. Okay, keep that. He'll probably want to plant it or something. Right, let's have a look at the liver. Yeah, okay, it's bleeding. Suction, please.
All right, what's that? BP's falling.
Aren't you glad we didn't bother with the aortogram? He needs to keep his pressure up or his kidneys will fail altogether. Right, this calls for Pringle's manoeuvre.
What's that?
Don't they teach you cardiac guys anything? How's Mr. Cronin's urine output?
It's fine.
Excellent. This game is all about decisions. Sometimes the quality of the decision is less important than the fact that you've made one.
Sorry, what's that?
Blood pressure's fallen 80/50.
He must be bleeding again. Stitch scissors, I'm reopening.
70/50.
Okay, check his clotting and have suction ready, please. It's dry.
My BP's back up again.
Just a blip. Probably a bit behind on his fluids, that's all. Okay, proline.
The BP cup on the other arm, please.
What?
On the left. Quickly, please.
What are you doing? His BP's back to normal. He's stable.
Look, it's lower on the left.
There's always a difference between blood pressures in each arm.
No, not that much.
Someone get a TOE machine in here, please. Now.
Okay, no panic.
If it ruptures, he will die, and both Darwin theatres are busy with pump cases.
Can't we operate here?
No, we need a bypass machine.
Okay, stay calm. You can still cross-clamp the aorta and repair it.
Of course, yes. I'm sure. What about the kidneys? With bypass, we can keep the blood flowing to the kidneys while we do the repair. Now, if we only clamp it...
We starve the kidneys of blood.
Right. Normal kidneys usually recover, but in his case, it'll almost certainly mean dialysis, probably for good.
So what if we wait?
More chance of a free rupture.
Well, what do you want to do?
Yes, I have no idea, and we should have done the aortogram.
What? You could have diagnosed this pre-op. Terrific.
But he's stable at the moment.
Seems to be.
Where are you going?
To talk to the family, see what Mick would want.
Yes, sorry, I'm just going to the bathroom.
He needs surgery to his aorta.
So what are you standing around here for?
Because we have a difficult decision to make. Ideally, we should put him on bypass, but that equipment won't be available for an hour or more. And there's a chance he could deteriorate suddenly.
What does that mean?
A delay might be fatal.
What's the alternative?
We operate now without bypass, but it's likely to cause irreversible kidney damage.
You mean dialysis?
Most probably. It's an unusual situation, so I thought I should ask what you'd think Mick would want.
If there's a chance of him dying, I'm not waiting. We operate now.
And put him on dialysis the rest of his life?
Ultimately, we could consider him for a renal transplant.
You think that's what he'd choose?
You know my brother better than me.
He's not stupid. He knows his kidneys will give out one day. We've talked about it. But it's too soon. There's too much he wants to do.
Oh, is that what he told you in your little chats? While I'm out there working like a dog for us all.
This isn't about you or the campaign. It's about Mick, about what he would want.
Is that where you were last night when they waved that stupid court order under my nose?
What court order?
It's nothing. Forget about it.
No. What court order? You knew they were going to cut those trees down, didn't you? And you sent Mick up there knowing that. Are you mad?
It wasn't my fault. The moment they saw him, they should have stopped.
And tough for Mick if they didn't. You know what? Forget it. I don't want to be with you or your campaign anymore.
All right, fine. And you? You want your decision, you've got your decision. We operate now.
No. He'd want to take the risk, I know he would.
If you checked his chest like you were supposed to, we wouldn't even be in this mess.
And he might have died in an X-ray.
If my brother dies, you're in deep trouble. Because this is negligence.
Blame anyone but yourself.
I'm serious. If anything happens to him.
Excuse me.
Glad you asked them.
Look, maybe you could have a word with them, please.
Mr. Cronin, I'd appreciate it if you didn't threaten my colleague. Look, all this arguing isn't going to help your brother. We need to make a decision. Seeing as your mixed blood relative, we'll be taking your wishes into consideration. All right?
All right, fine.
Good.
Why did you decide to do that?
One, Paul is the next of kin, so his views carry more weight. And two, it reduces the chance for backlash.
You think I'm worried about getting sued? We need to do what's right by the patient.
Sued? Do you think it would end there? Like you said, it's not the quality of the decision. Scissors, please. Right, come on, in there.
BP's 90 systolic.
All right, go easy on the fluids, please. Don't want Mr. Cronin's pressure any higher until we've got a clamp on the aorta. Spread it.
Have you done many of these before?
Not exactly. All right, there it is. The second scissors, please. Right, it's ruptured. Suction.
BP's falling.
Yes, get me some clamps, please, clamps.
He's starting to bloody down.
All right, get your hand in there and try and compress the aorta proximally.
I've got control, just.
All right, proximal clamp on.
He's arrested.
Distal clamp.
Starting internal massage, heart's empty.
Right, you heard the lady. Get the fluids on board now, please.
2 more units of jello and get me some adrenaline. Complete.
Okay, we've got him back. Heart's filling. BP 60. 80.
Let's replace the damaged section of the aorta with a 20mm graft. The quicker we go, the less chance his kidneys will be completely ruined.
Yeah, good call. Complex case, wrong theatre, but you're still calm. What's your secret?
That's all. If it was easy, they'd let liver surgeons do it.
Must have been the high-quality assistant.
Something like that. All right, suction out.
The aorta through an incision in the chest.
You look as though there's a butt coming.
I'm afraid that the operation put a huge strain on the kidneys. It's possible they won't recover.
Not ever.
Maybe not. I'm sorry.
Can I have a minute, please?
Excuse me.
Are you okay?
Do you think I made the right choice?
I don't think you need to feel responsible for the decisions that were made.
Ah, come on. We both know I bullied you into doing what you did. It's all right. There's no need to make me feel better.
I think if we had another try, we'd both do things differently. But that's just the way it goes sometimes.
What's it going to mean for him?
We don't exactly know at this stage. But it looks like Mick will need some kind of long-term support.
A kidney machine?
Yes. If he needs hemodialysis, he'll have to come back to the hospital 3 times a week. But he might be able to do something called peritoneal dialysis, which he can do at home.
But not anywhere else? There's something else I need to ask you.